Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30+ lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30+ lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Welcome to Redefining Medicine. Today we're interviewing Dr. Tom Fabian, a functional nutritionist who's a researcher, obviously, and who will be giving a talk here tomorrow. And I want to ask more about the talk. Thank you, Dr. Fabian.
Thank you so much for inviting me.
My pleasure. So tell us about the talk tomorrow.
So tomorrow I'm going to be speaking on the topic of the intestinal barrier and its link to inflammation, particularly, of course, in aging. Mm-hmm. So we're going to focus primarily on the role of the microbiome, diet, and lifestyle factors, and how that can help practitioners influence the health of the barrier. So I think it really starts with, why are we interested in the barrier? Why is it important? And so we know that the intestinal barrier is the key interface between the environment and our body. So we're exposed to microbes, we're exposed to foods, we're exposed to chemicals, drugs, etc. So this is such an important interface that influences our health. And so what I do is I'm a translational scientist, so I'm in the literature a lot, sort of reading the latest research to try to figure out what's going to be most applicable to practitioners and help them further understand their patients and what's going on, and really kind of pushing the envelope a little bit towards where can we go further with this in terms of understanding and treatment. I think for practitioners it comes down to really understanding the intestinal barrier. So there's really a lot of opportunity there to go beyond the current concept of leaky gut. So hopefully we can talk a bit about that, and how practitioners can get a more comprehensive view of the barrier. And that's really important for understanding then, how does that link to aging and age-related disease? Because you can have different components of the barrier that are affected during aging. Then how do you measure that, right? How do you assess that with clinical testing? Then how do you take those results and then apply them clinically, primarily again with diet and lifestyle factors? So that's really kind of the broad overview of the talk. And again, because I'm sort of trying to push the envelope a little bit further, I go into some details about the role of stem cells in the gut, etc.
So you're talking about using the stem cells to reinforce the barrier?
There's actually, so there's stem cell therapy, which is a different sort of thing than using lifestyle and diet factors to influence the barrier. So there's something called the stem cell niche. So these are cells that are at the bottom of the intestinal crypts, and that's when we think of gut healing. So that's a common concept in our field. We know there's certain supplements that are commonly used, for example, like glutamine, zinc, carnosine. But actually, there's a lot more that we can potentially do because we know that dietary factors and the microbiome influence the stem cell niche. So they can influence the health of the stem cells, how often they divide, and then what kinds of cells they become. So this is really kind of a new paradigm in gut healing because, again, in our field, we mostly think of leaky gut as kind of the key factor that you want to assess, or the barrier. And of course, that is important. It's been studied for many years. We know that it's linked to aging and aging-related diseases. But ultimately, when you're talking about gut healing, that's happening from these stem cells. So we know that the gut epithelium, which is the cells that line the gut, that those are basically turning over every 3 to 5 days. So essentially you have a whole new gut lining every 5 days or so.
Right.
So your body's doing this, but it's such a finely tuned process that if something is off, if you have your diet that's not healthy, inflammation, you have an imbalanced microbiome, then that can start to affect that stem cell niche in a way where you're going to get a different balance of cells produced potentially that can alter the function of the gut. So I think the key here is it's a complementary way to view gut healing and the role of stem cells in gut healing, because we're not necessarily totally dependent on high-tech therapies. Those certainly have their place, but we also can do some of these basics, assess patients for their diet, their lifestyle, and then that can have a pretty powerful role on healing the gut barrier.
That sounds amazing. Now, it's the first time you're speaking at A4M.
Absolutely.
And what are your thoughts on A4M and the audience that you're going to be speaking to, addressing?
I think it's a great conference. It's very exciting. Lots of people from sort of all over the world coming here to learn. Some are more experienced in it, so they're the ones, of course, that are often teaching. So there's a lot of wisdom being handed down, but also a lot of new people who really just want to learn more about this field and then how to better practice anti-aging medicine. So for me, it's very exciting. I've mostly been to microbiome conferences, functional medicine conferences. So it's just very nice to see how this plays out in this particular field.
So when you say about functional medicine conferences, what's the difference, do you think, between A4M and the functional medicine conferences?
That's a great question. So I think they're converging more in some ways because there seems to be more of a focus in the anti-aging field on diet and lifestyle factors and certain types of testing that are frequently used in functional medicine. So I think functional medicine has been sort of a pioneer in the past in terms of using certain types of testing, such as gut health testing,
Right.
which I hope we're going to talk a little bit about as
Yeah.
well, since that's a great way to assess the intestinal barrier. But I think there's a lot of overlap, actually. I think there's similarities in trying to preserve health, restore health, optimize health. Of course, in the aging field, that's over a longer period versus just dealing with this current chronic situation, which is part of the equation because you may have to deal with that condition in order to reduce inflammation and then
Right.
further improve lifespan.
Right. Talk to me more about gut health.
Absolutely. So that's, of course, my favorite topic. It's what I study. So gut health is really, again, something you want to look at comprehensively. So I think all of us tend to get a little bit myopic sometimes, and that's good. That's sort of this concept of precision medicine. If you can identify the bad microbe that's causing symptoms, target that microbe, and then patients may improve. But behind the scenes, there's all these other gut functions happening, and there's the microbiome. So comprehensively, we're looking at things like digestion, motility, immune function, also the balance of microbes in the gut. And then there's other markers as well for health, things that reflect inflammation, whether there's occult blood, things like that might be more serious. So you're looking at kind of a range of markers when you're looking at gut testing to assess a patient for gut health. So that's really, I think, the key is taking kind of a step back and looking at the big picture from a sort of systemic systems biology standpoint. And how do we look at this system? Because that bad bug that we see on a test, certainly targeting it with a protocol may be helpful, but you want to understand why it's there. So again, in our field, we tend to focus a lot on root cause. what is causing that? What are these imbalances? And it turns out simple things like digestion, poor diet, all these lifestyle factors that we're pretty familiar with really have a big influence.
So when you're talking about the measuring the state of the gut health and you're talking about digestion, what tests do you use to do digestive, let's say?
I would say that the sort of most popular foundational testing is called comprehensive stool testing.
Right.
So these tests include kind of two sides of the equation. So when you're looking at gut health, you want to understand the microbiome.
Mm-hmm.
What are the bad guys that are there? What are the good microbes that are there? What's the balance? So that's a big part of the picture. The other part is the physiology. So you really want to understand, again, is digestion working? So there are specific digestion markers with comprehensive stool testing, markers for inflammation, markers for intestinal permeability directly, such as zonulin. Zonulin is a common marker. And then again, other factors that really help you understand what's going on sort of physiologically in the gut.
So in the blood, you look for which ones of the tests?
This is actually on stool samples primarily.
Right. So you have the blood that you're looking for inflammatory markers, et cetera, right?
The inflammatory markers are actually also in the
stool.
Yeah. So you're looking at what's being produced and released.
So it's a stool sample that
Absolutely. Yeah.
goes, and then it gives you all the information that you need.
Yeah, there's an awful lot of information you can extract from a simple stool sample.
Right. Interesting. Any other tests that you do?
As far as the ones I would suggest, there are a range of leaky gut type testing. So zonulin is a great marker if you want to know more about that. There's something called the lactulose mannitol test,
Right.
which is a fairly simple test. And there are a few blood markers as well. Zonulin can also be measured in the blood.
Right.
Some more kind of experimental markers that are not widely recognized yet. Antibody testing. So you can look for antibodies against these leaky gut components, tight junction components. So those would be the main ones, but it depends on the details of the patient. So if a patient has food sensitivities, those sorts of suspected food reactions, then sort of a food allergy test, food sensitivity test might be a route that a practitioner will go down.
Would you do that in the blood, or would you do that like allergy testing, skin testing?
That's a good question. So in terms of allergy testing, probably one of the standards is skin prick testing for both respiratory allergens and also food allergens. There are serum tests for IgE, basically to specific foods, et cetera.
Right.
Those are a little more controversial because they're not as specific. They don't confirm that a patient's going to have an actual reaction.
Yeah, I wanted to actually ask you about that because you get the results. What's the connection between the correlation between the results and what's really going on in the food testing?
Exactly.
The bloods.
Yeah, so there is a correlation for sure, and that's why it's still done frequently as far as the serum testing for IgE.
Right.
But it's not a perfect correlation. So you can have antibodies that are picked up for a particular food, and a patient may have no symptoms for that. So that's why even if you have a blood test, then a lot of allergists will still confirm with something like a skin prick test.
And then they'll treat how?
There's a variety of ways to approach that, but typically for food allergies, they'll use something like antihistamines to reduce the reactions. As more of a preventative measure, they'll use oral immunotolerance testing. So basically those are the allergy shots, where you get an armful of the antigens that you're allergic to, starting from a low dose to a higher dose, and you slowly build up tolerance to that.
What do you think about the oral drops that they use?
That's a good question. Unfortunately, I don't really know much about those. I've read a little bit, and I think it's very promising. Certainly a better route of delivery for patients. And the one thing I do know is the reaction that elicits, the immune reaction, is a little bit different. So when you're injecting the antigens, then you get more of an IgG type response. And then if you do the oral, the sublingual type therapy, then you get a bit more of the IgA, immunoglobulin A response. So there are differences there, but it's still relatively new, so we don't really know what the implications yet are of those two approaches.
Right. Well, it sounds great. I mean, the future of, gut health is really the future of our whole health. So thank you so much for helping us out a little bit. And good luck on your talk tomorrow.
Thank you.
I look forward to watching it.
Thank you.
Thank
I appreciate that.
Thank
It's
you.
great to be here.
Thank you.